Welcome back, my people. I always start by appreciating your support and the far you have taken me within a short duration of time. If it were not for your support, this channel could not have been where it is at the moment. Road to 20,000 subscribers, and I know through your support, I will go even to 100,000 subscribers. So for those who have not subscribed, what are you waiting? Make sure you subscribe and put the notification bell on so that whenever I produce any video, YouTube will automatically notify you. So we are still discussing about vomiting, and in this video we'll start by looking at drinking more fluids while vomiting, or when you have this kind of problem. So drink more fluids. If you are vomiting, a lot of fluids are very important to avoid dehydration. So it's critical to drink plenty of fluids to help prevent dehydration. Drink slowly, because drinking too much when your stomach is upset may cause more vomiting. So even if you are taking the fluids, just take small sips. Don't drink a lot of it at the same time, because your stomach is upset and this might make you vomit more. So drink slowly, because drinking too much when your stomach is upset may cause more vomiting. Fluids that help keep you hydrated and may ease nausea can include the following. So we have some fluids that will help keep you hydrated and at the same time help prevent nausea or vomiting. For example, herbal or mint tea. Herbal or mint tea. Number 2, we have lemonade, we have water. So we have lemonade, we have water, we have herbal or mint tea. Suck ice chips to stay hydrated. Ice chips also help you to stay hydrated. So you should make sure you sip or suck ice cubes to stay hydrated. Let's talk about what we call aromatherapy for nausea and vomiting. Aromatherapy comes from the word aroma, that means scent, odors. It means having a certain smell, a specific smell can prevent nausea and vomiting. Is that true? So aromatherapy for nausea and vomiting. Aromatherapy may help relieve nausea and vomiting, though studies on its effectiveness are mixed. That means we have no clear-cut study that shows that aromatherapy can prevent nausea and vomiting. That means it can work for some people and others it won't work. So aromatherapy may help relieve nausea and vomiting, though studies on its effectiveness are mixed. To practice aromatherapy, try deep breathing with an open essential oil bottle. That means the bottle containing the oil that you want to get the smell should be open. So to practice aromatherapy, try deep breathing with an open essential oil bottle. An essential oil diffuse or add a few drops to a cotton ball. Scents that are believed to have effect on nausea and vomiting include the following. So the following are the signs that are believed to alleviate or to prevent nausea and vomiting. Number one, we have clove scent. Number two, lemon scent, ginger scent, lavender scent, rose scent, fennel scent, and also we have peppermint scent. A point to note, if you have asthma, or if you are asthmatic, or you have any airway obstruction condition, be it asthma, be it bronchitis, be it pneumonia, that can be triggered by certain smells, whereby asthma is the best example. So if you have such a condition, ask your doctor before diffusing essential oils or before practicing aromatherapy. Make sure you consult your healthcare provider so that he or she can give you the way forward, whether to use it or not. If it can trigger an attack, don't use it. But if it's safe, it can't trigger an attack or an asthmatic attack, just go for it. I hope you get that point. So, another very important question to ask ourselves, when to see a doctor, or when should you see a doctor when having this kind of a problem? Not all cases of nausea and vomiting require a visit to a doctor, especially if the symptoms are mild and temporary. Get this very clearly. Not all cases of nausea and vomiting require a visit to a doctor, especially if the symptoms are mild and temporary. However, see a doctor or call a doctor if, number one, your child vomits more than 24 hours. If your child is vomiting repeatedly, not retaining anything for more than 24 hours, just see your doctor, because this can lead to severe dehydration, and we discussed about the dangers or the complications of dehydration, for example, kidney failure or kidney damage, and also brain shrinking. Number two, see your doctor if there is blood in your vomit, or if your vomitus is bloody. See your doctor. Number three, visit your doctor if you have signs of dehydration. If you have signs of dehydration, make sure you see your doctor so that maybe you may require intravenous fluid. These signs may include infrequent urination, dark or concentrated urine, and dry mouth, which are always the major signs of dehydration. See your doctor if vomiting comes and goes for more than a month. If vomiting comes and goes for more than a month, make sure you see your doctor. And the final point, see your doctor or your healthcare provider when you are losing weight from long-term nausea and vomiting. When you are losing weight from long-term nausea and vomiting. In our next video, we will be discussing about when should you consider vomiting as an emergency. Can vomiting be an emergency? We will see this in our next video. So let's keep locked. Let's keep the support on. And let's meet in the next video, whereby we will know when should you consider vomiting as an emergency. Thank you for your time. Thank you for keeping the support on. Thank you for making me part of your family, and let's continue with the same spirit. Have a good evening.